Hi there, my name is Taylor Chatwin, and I am a student at Parker University. And today I am going to talk to you a little bit about spinal stenosis. So, spinal stenosis is a narrowing of the spinal area, which basically causes a compression on the nerves and the nerve roots. So, it can affect a variety of different areas in the body because of this compression on the nerves. So, some common areas of the spine that you see stenosis are actually in the lumbar spine and in the cervical spine. Lumbar spine can be associated with a lot of lower back pain that people might be complaining about that just doesn't go away. It's kind of that chronic lower back pain. And cervical spine can exhibit some stenosis as well. So, some narrowing can generally caused by aging, arthritis, disc herniations, or thickened ligaments. So that is just a little bit about stenosis. So some of the symptoms that people might face if they do have stenosis would be nerve issues, sensory type issues. So if somebody has stenosis up in their cervical spine, they might have issues with some sensory skin uncomfortability, which tends to happen. They might not have the best motor functioning in their fingers or in their thumbs. So that's kind of a big one. So sensory, fine motor, might not be able to brush their teeth very well, button, snap their fingers. That's if the stenosis is serious. Some other symptoms of stenosis would just be pain in the back or neck, numbness or tingling in the arms, muscle weakness, or difficulty walking or balance issues. Again, some of that difficulty walking, balance, gait issues can come with stenosis that is more severe. So that really means that the nerves are being compressed and it's causing those issues throughout the body. Some imaging modalities that might be used to assess stenosis. So initially somebody might get an x-ray right off the bat, but that doesn't really show us the spinal cord or the soft tissues or the ligaments that we might want to see with the stenosis or the nerve roots. So the gold standard for spinal stenosis modality imaging wise would be MRI. It would give us the greatest detail on those nerve roots, the spinal cord itself, the spinal canal space and how big it is or how small it is, and really gives us an idea of what we're working with in terms of the space within the spinal cord region. So, chiropractic treatment could be used as a conservative treatment for spinal stenosis. Really, it's not going to treat the actual narrowing of the canal itself, but it can help alleviate some of the symptoms that somebody might be facing as a result of stenosis. So some of the musculoskeletal pain that they might be having, some stretch-like things that they could be doing to alleviate some of that pain. Flexion distraction therapy, that would be releasing the nerve pressure and stretching the spine, which would be a really good option just to relieve some of that pressure. Soft tissue therapy to work with all the soft tissues that are affected around the stenosis as well. Posture correction, which would be good for the stenosis. Again, the goal of the chiropractic treatment is to improve the mobility of the individual who might already be facing some issues due to their stenosis. So we're improving the mobility, we're improving the soft tissues around there. We're just trying to get as much fluid motion in that tiny area as possible, because remember the area is restricted. Some more invasive or aggressive treatments would be something like surgery. For example, you can do a laminectomy, which would remove part of the vertebra in order to, specifically the lamina, in order to create space within the spinal cord so that the nerves are not so compressed back there. That's another good option, but again, that's surgery, so it's not as conservative. Physical therapy would help with the flexibility and balance in reducing the pressure. Medications, some pain relievers or over-the-counter medications would probably be helpful as well for the individual. Spinal stenosis is a severe condition. It's commonly seen in older adults. It can be seen younger, again, as just a result of aging, degenerative joint disease, things like that. So it's very important to take care of it and just be aware that it does have an impact on the nerves and can have an impact on a variety of different systems within our body as a result as well. So it's very important to take care of.